Occupational therapy has a great value in working with older adults and people with dementia because they bring to the care environment an understanding of a person's physical, emotional, cognitive abilities as well as the environment. And they have a way of putting that all together because when you're an older adult, it's all about function. Okay, it's all about maintaining your daily activities of living. And occupational therapists are highly skilled at helping older people set up their environments and daily routines in a way that can maximize their participation in valued activities.
Occupational therapy can benefit an individual with dementia. Many times people feel that since dementia and some of the dementia-related disorders are degenerative, that the client's going to get worse, that why would you have therapy intervene? And there's a lot of reasons. Our clients are certainly living longer with technology and medicine. They are just living longer, and they deserve and need a quality of living. Our clients, even with the dementia, can do a lot for themselves, believe it or not, if the environment supports that. Certainly there are clients that are on different levels and different stages of the illness. But occupational therapy can really intervene on any stage. What we're focused on is tapping into those capabilities the client still has, those skills that you can still utilize from long-term memory, what we call procedural memory. We can work with these clients such that they can do the best that they can with their everyday activities.
The occupational therapist can have a number of roles working with individuals with dementia in nursing homes. The first is the more traditional role of occupational therapy, and that is to provide rehabilitation if that person so needs it, if they've had a fall, if there is some dramatic change due to other illness in their functional ability. Occupational therapy consults are part of the treatment process to get that person again up to functioning as to their highest level of capacity. So I think that's been and continues to be an important and traditional role that occupational therapy can play. Another role, though, is that the occupational therapist can serve in an assessment capacity. So that if nursing staff, for example, find that a resident is exhibiting a lot of agitation, behaviors that are very difficult for the nursing staff to handle, an occupational therapist can come in and make observations of how the nursing staff is communicating to that individual, what the environment looks like, what's going on in their room, and so forth, and can then make a plan of action that the nursing staff can follow. There can be very small changes that may occur in a person's room, for example, that can create or serve as a trigger for a catastrophic reaction. So I'm recalling one case in which a new nurse's aide had started working with a resident, and she put this one person's clothing in the side of the bed that the person was not used to. And that person was able to dress herself, but then completely declined. And not only in dressing, but in many other areas. And so having an occupational therapist come in and evaluate the situation and understand that the person needed her clothing hung up behind the door in a certain way, or in front of the door in a certain way, or on the bed a certain way, was a very effective intervention. And she could educate, the OT was able to educate the staff as to the importance of maintaining that kind of dressing program for this person, and that person was able to return to their previous level of functioning. So
when an occupational therapist works with a client that has dementia, her approach may look different than with other clients. It's important to understand the disease. It's important to understand how many of the behaviors that someone with dementia is experiencing is a direct relationship to the illness as well as the environment. So with that being said, the occupational therapist will take particular care to make sure that the environment is distractive-free. She or he will be careful in the types of communication they use with the client. They will use various cues that they may not need to use with someone that's cognitively intact. So we will either give visual cues, verbal cues, we'll give tactile cues, hand-over-hand cues with an individual with dementia in order to facilitate function and activity. With all of our clients, however, we're always focused on what's their interests, what are things that they might have done in the past, and we'll pull those activities from previous roles into treatment because that makes best sense for that individual with dementia. If they never cooked before in their life, you really don't want to use a cooking activity as your therapeutic method. So having a good understanding of their leisure, their past leisure roles, their roles as a husband, wife, parent, those are key to integrating into therapy and using interventions that will be of most interest to them. Well, the occupational therapist will pay special attention to the caregiver when working with a client with dementia. And that caregiver could be a family member, it could be the nursing assistant. But it's critical that we work with the person who is taking care of the one with dementia. Because they're going to follow through on the strategies, they're going to follow through on adapting the environment, and this will in fact allow the client with dementia to perform at their highest capability. How do we know that occupational therapy is effective? One of the things that occupational therapists are skilled to do is systematically evaluate a client initially. We have standardized assessments that we use. We also base it on the clinical interview that the client is telling us what they like to do, what they need to do, and how they would like to do it. So it gives us a baseline of the function of that client. And so throughout treatment sessions, we may tweak the program, we may modify it. We will do what we need to do to show progress and improvement for that client. And then after intervention, we assess again. And we see where there's been improvement and change.
With the progression of the disease, if a person does not die from another illness, there is a slow deterioration such that the person will become bedbound and non-responsive to their environment. At that stage, which is really the end stage of the disease, the occupational therapist's role is different than setting up activity programs